Hi, Dr. Ahadian. Continuing with the obsessive compulsive disorder and sexual dysfunctions. One issue to discuss is that the sexual dysfunction is not necessarily just a symptom of the obsessive compulsive disorder. However, in people who suffer from obsessive compulsive disorder and have ritualistic behaviors to avoid contamination and frustration about the fear of getting contaminated, we see a lot of sexual dysfunctions with regard to being able to express sexual energy appropriately and have contact with humans due to the fear of the contamination and the socially isolated and restrictive manner of the system, which causes problems with regard to self-expression, both emotional in a social function and sexual in a more intimate relationship function. Now, the problem solving with this aspect is basically we have to have a condition to go through the pain and frustration of dealing with the fear and thoughts of contamination, and to set ourselves and limit ourselves and discipline ourselves and our brain in order to be able to get rid of this problem with the help of anti-obsessive compulsive medication, which are the serotonergic reuptake inhibitors, and with regard to downregulation of the receptors in the brain related to the perception of this kind of messenger systems in the brain, which I will discuss further. With that, the issue is like, disciplining the sleep of a baby at age 2, 3, 4, 5 months. People put the baby in a different room and discipline the loneliness and frustration the baby has to go through with regard to not being able to get milk in different hours of night. And we see in the first night we're going to have like half an hour crying, and then maybe then second will be 15 minutes, 10 minutes, and 5 minutes, and then we're going to take care of the situation. The sleep will be disciplined. The same way, we have to go through this pain and frustration of changing our patterns of behavior and going through the consequences of that with sleepless nights and fear and frustration and dreaded ideas. Until we get through that with combination of medication, which would put this system at ease to be able to implement the behavior part of the anti-obsessive compulsive management and treatment of this disorder. This is a very complicated and extensive discussion, which I will discuss later, and let me know by your comments, and I would appreciate that. Thank you.